When I was younger, I couldn't decide if I wanted to be a teacher or a nurse. And I would go back and forth on that. And my mother said to me, she said, if you become a nurse, you will also be a teacher because you'll be helping people to learn to take care of themselves. And so that kind of is what pushed me to become a nurse.
I'd actually started as a CNA when I was 18 years old. And I went into home health care for a while, and I took care of a little patient that she and I became very close. And I walked in one day to take care of her, and she was having a heart attack. And she ended up, I called 911, I got her to the hospital. And 2 days before she passed away, she was in ICU, and her family called me to talk to her on the phone. She had something she wanted to say to me. She got on the phone and told me that I was meant to be a nurse and that she encouraged me to go on to be that. And that's what kind of led the way.
When I was 4 years old, I went to work with my father, and he was up on a 2-story roof, and he sat his hammer down on the roof, and it slid off and just happened to fall right where I was squatted down playing with rocks. And so I had taken the claw of the hammer to the head, and I was taken to a hospital. The doctors told my parents there that I didn't have a very good prognosis, that I probably was not going to survive. And so I was transported to Parkview Randalia. Recently found a card actually in some of my memorabilia that said I was in room 641. And my parents talked about how caring and compassionate the nurses were to help them watch their 4-year-old be in such a critical condition.
I'll tell a lot of my new employees or my new nurses that the first year you wonder, why did I decide this path? If you're really giving the good, compassionate care, then you're fighting with your patient, especially in ICU. You'll see that you're fighting for their life.
I worked the night shift because when you were a new grad, you started on the night shift, no questions asked. And it was, I think it was it was either 22 or 24 bed unit. The LPN and I would split the hall to do the care and pass the meds, and the tech or the unit assistant would, help kind of run up and down and help with everything.
My first year being in nursing, it has definitely been an emotional, mental type of roller coaster. Coming into nursing and having COVID going on, the pandemic going on, you have a different way of nursing. I did have my days where I would just go home and, my family, my children, my husband would look at me and they're like, "Are you okay?" And I'm just like, "I'm okay." Just mentally, just kind of checked out for the day. You learn so much.
Shortly before COVID started, I transitioned from a bedside nurse after 34 years to the manager role in the medical ICU. And so I was still trying to get used to that role and what I was supposed to do. And now all of a sudden there's a pandemic and nobody knows what they're doing, which is probably the only thing that saved my sanity. Was I was with a bunch of other managers who had never been through anything like this as well. Mm-hmm. So we were all kind of in the same boat. I went home a lot of days feeling like I didn't do enough that day because I didn't know what to do. I didn't know how to make it better for my experienced nurses, for what we're now terming our COVID grads, who were those new grads who started right at the beginning of all this. It was good to see the resiliency of our team, but I also learned that some of even the toughest nurses that we have had their breaking points, and that was heartbreaking.
The last year, definitely during the pandemic, with us being the COVID ICU, definitely was trying. We put our best foot forward. We were battling up against something that no one really knew anything about, and we didn't know walking into a room if we were going to contract COVID or not. I've never seen a bunch of nurses and medical staff that actually just fought through that, and we pulled together. But I think the most touching thing that we've ever seen was the community coming together and supportive of us. We had people bringing food in for our unit, for us nurses and medical staff and supportive staff. That in itself, I think, did more for us than anything. And it really made our fight worth it.
I guess maybe with your guys' experience, what would be your best advice as far as sometimes when you are a person that asks a lot of questions and likes to make full circle of everything and understand everything?
I kind of grew up with, behind every great doctor are the nurses that he taught. And I mean that in the aspect that I had a lot of great physicians who enjoyed my questions, and they taught me their way along the way. When you have questions, no one knows the answer. I tell people, if I don't know the answer, we'll find it together. So you can always call me. I can always answer whatever you want. You know, I may not always know the answer, but we'll find it together.
I've learned a lot of things over the years from doctors, sometimes from just listening to them talk to their patients or a family member. I've tucked away little tidbits that I have used in situations where the doctor wasn't there, but I was, and was able to use those things. If I go back again to my first year of nursing, when I was on that night shift with that LPN and that unit assistant, I probably learned more from that unit assistant than I did it, because she had so much more experience and she had been in these situations, you know, and seen these things before. So just don't underestimate who you might be able to learn from.
Keep striving to definitely be the great nurses it sounds like you guys are. I haven't had the blessing to work with you, but it definitely sounds you both have great hearts, and you should be enjoying and being appreciated for Nurses Week. So happy Nurses Week.